Hey guys, welcome to Cozy Talks Live for April Limbs Loss Awareness Month. If you're watching the replay, go ahead and comment replay. Give me a shout out in the comments. Put your question in there. I do go back after the show is over to review any comments or any questions that may have been posted. All right, we're going to take a few seconds here to let my Instagram go live because it just does take a little bit of a minute there. A little bit of a time lag, and there we go. We are live on Instagram, YouTube, and Facebook. Okay, so we're going to give you guys a minute or two to jump on board. I'm running a little late this evening because I had a little technical difficulty. I was trying to get a picture posted so I could show you guys regarding tonight's topic of discussion. So one of the questions that was posted to me recently in the text box was, what is a shrinker and what is the purpose behind a shrinker? Right? Hey there, Bill. Good to see you, man. Water in your jug. All right, guys. So I'm going to go ahead and switch the screen. So the shrinker is a device that's given to you after amputation. And the purpose behind the shrinker is to help aid with reducing the swelling and reducing the volume in your limb. Okay. So just the quick 101, when you go in for surgery, or you have any kind of trauma to your body's response is inflammation, right? So it sends in the cavalry to the area of the injury to start promoting the healing. And in the process causes a lot of very uncomfortable swelling. The swelling is what causes your pain. Okay. A lot of people, when they come out of surgery, this is something that they need to hear. The swelling pushing up on all of those structures, the nerves, the muscles, the bone that's just been cut, right? That's what's really inflicting the pain that you feel after surgery. Okay. So one of the many ways that we help address this pain is by using compression therapy. So in your early days after surgery, you may have been given a special type of cast called an Uniboot. You may have been given an air splint. You may have received a Tubi grip. It's like a little elastic tube that gets put onto your limb. And these are very gentle beginning ways to help with compression to start pushing that fluid out of your limb. So those methods of compression combined with ice, pain medication, and movement, right? This is where the physical therapist comes into play to teach you how to start moving and how to start contracting those muscles, right? That helps to move the fluid out of the limb. Hey there, Chuck. Hey there, Pastor David. We got Janie coming in from Canada too. All right. So Janie, listen to this part, okay? Because this is going to help with your question, okay? So after the first 6 weeks from your surgery, by that point, most people, God willing, are cleared by their surgeon. The sutures are out, the wound is nice and closed, and they are issued, or actually a couple of weeks, not 6 weeks. Let me backtrack that. When your wound is completely closed, right? And the sutures are removed and the surgeon has given the clearance for you to go ahead, then they will issue you a shrinker. Okay, so here's a picture of a shrinker. Let me see if I can call it up properly. There we go. And guys, sorry, I had some trouble with my graphics this evening, so it's like superimposed on my poster from last Wednesday's talk. But this is an example of an above the knee shrinker, okay? So you can see the residual limb is going to fit in there, and then the strap is used to kind of like hold it onto the body so it doesn't slip off. And you can, this is actually a pretty nice, good picture. You can see like it's made out of pretty thick elastic fiber, okay? So this is different from the liner. This is not the same thing as the liner. And this is something I always like to clarify because sometimes people get this mixed up, okay? So again, the sole purpose of the shrinker is to really get that compression going. So that's why they hold off on giving it to you until your sutures are out and your wound is closed, okay? Because if you use this aggressive compression right after surgery, you're going to pop that wound open, especially when you're trying to pull it on, okay? So again, it's a great tool, but there's a definitive time to use it, and you have to wait for your surgeon to clear you on it, okay? Hey there, Harsh. Hey there, Tom. We got my Harsh and Tom and Kathy on board, okay? So once you start wearing this shrinker at the 2-3 week mark, you know, you're usually told to wear it 23 out of 24 hours a day. You only take it off for the 1 hour for bathing, okay? And then you keep wearing it until they give you a prosthesis. Once you start using your prosthesis, you only wear the shrinker when you are not wearing your prosthesis. And again, I always like to clarify this point. The shrinker is not meant to be worn with the prosthesis. Okay, so this is kind of clarifying this point, right? And then as you recover, as time goes on, right, your limb is going to undergo a lot of different volume changes. It's going to pop up, it's going to go back down, it's going to pop up, it's going to go down. But over the course of time, it's going to have an overall shrinking effect, and we want that. Okay, that's telling us that the tissues are remodeling, swelling is moving its way out, and your limb is becoming more mature. Okay, so then the next question I get is, do I have to continue to wear my shrinker all the time? Okay, once your limb becomes stable, meaning it's not going these crazy volume fluctuations, then no. In the ideal scenario, you will be wearing your prosthesis for most of the day and hopefully into the night, right? Until when you wake up in the morning, and then when you close your eyes, that's the goal. That's when you have your prosthesis on. And then a lot of times I do recommend that people wear their shrinker at nighttime so that they don't have like what we call a rebound swelling effect. Okay. And this will hopefully prevent that morning amputee dance that you got to do to kind of get yourself into that socket because your limb got a little puffy overnight. So wearing the shrinker overnight kind of helps mitigate this. Okay. Now, I also like to make the distinction that a liner is not meant to be used as a shrinker. Okay. I've had some clinicians that will tell their patients that they can wear their liner as a shrinker. No. Okay. Again, a liner is supposed to fit very snugly, and it may give the impression, right, that it is providing the right amount of compression, but the way it's designed is not the same way a shrinker is designed. Okay. The shrinker is designed to give more compression at the bottom and grade it up through the top, less at the top. A liner, my understanding is a lot of it is just a uniform, not compression, it's uniform fit. Okay, so there is a difference between the liner and the shrinker, and you're not meant to mix one with the other. You don't wear your shrinker in the socket, and you don't use your liner as a compression device. Hopefully that makes sense, okay? Now, another question that came in that's kind of a side-by-side question with this. Hey there, Michelle from Michigan. Hey there, Pam. Is that, is your limb always going to be changing? Okay, and the answer is yes. To some degree, your limb will always continue to change. Why? Because our bodies are always changing, right? The aging process takes place. We are never the same from one day to the next. Now, some of you may still continue to have dramatic volume changes, and that might be due to some of the medical conditions that you have, your diabetes, your blood pressure, autoimmune disease, anything like that, kidney disease, cardiac disease, right? But even those of you who have relatively healthy medical histories and you follow a good diet and water intake and all of that kind of good stuff, you're going to notice minor fluctuations, okay, over the course of time. Okay, and we have wonderful tools available to us now, things like adjustable socket devices like the Click Medical RevoFit, which we talked about last week. There's things about, learning more about your nutrition and optimizing your nutrition to help with this. Right. And then obviously addressing the underlying medical condition. Okay. So let me just kind of look at my cheat sheet notes real quick, guys, because I just want to make sure I got. So yeah, hopefully, Janie, I answered that question. Is there a time where your residual limb stops shrinking? And again, everybody's a little bit different. I've seen some people who have like super, super pencil thin residual limbs, and other people who have bigger ones. That's just unique to every person's body type. Okay. And it's also dependent on how much soft tissue was left, with the amputation, and how the surgeon secured everything before closing everything up during the amputation. So all those things kind of play a role in how your residual limb is going to look later on down the line. Okay. Another question that I'm going to answer. I know I'm only supposed to be answering one question per night during my April Limb Loss Awareness Month lives, but this is a question that's been a recurring theme. And, I love a good soapbox. So last week I did a show and I titled it, "Is It Time to Break Up with Your Clinician?" A very high school, catchy themed title there. We talked a lot about when it's time to potentially walk away from a relationship with your clinician, whether it's a physical therapist, a prosthetist, a doctor. Okay. And, because of the nature of amputee, a lot of you work a lot with your prosthetist more so, and you experience this. I feel like you experience this more with your prosthetist because unfortunately a lot of you guys don't work with physical therapists. But again, this can happen with any clinician. So, we talked about some of the red flags, that you need to look out for in your relationship with your prosthetist. And I had someone else, message me today, and this particular individual has been through the gauntlet. She has reached out to me several times over the past years, and she has truly had a lot of hardship. And I really admire her perseverance and continuing to want to improve and not give up. And she recently mentioned that she lost a lot of weight, and that because of that, her socket was not fitting well. And she feels like with the prosthetist that she's with, that they keep trying to pigeonhole her to a particular product because it's a product that they are that is new to that particular clinic, and they want to try it out. And I guess she went ahead and agreed with it, and it's not working out. And she's having a lot of pain. And then on top of that, she's having a lot of folks, not a lot of folks. She's having this very same prosthetist who is quite frankly being rude to her, and not wanting to answer her questions and making her feel like she's, not a good feeling overall. Okay. And wondering what to do. Okay. And guys, I can get really hot and bothered about this, but at the end of the day, I do understand that when you are, when you're experiencing something like amputation or cancer, you're in a pretty vulnerable place, right? Especially if you're not a clinician and you're learning the process of being an amputee and having something this traumatic happen to you and trying to get your head straight and get your world righted back again. So it is you want to be able to trust the people who are supposed to be there taking care of you, your clinicians, and you should be able to trust. You should be able to have a good rapport with the people you're going to be spending a lot of time with for the rest of your life. And that's your prosthetist, that's your doctor, that's your physical therapist. Okay. So first of all, rudeness is not acceptable, under any circumstances. I don't care what kind of a bad day the clinician is having. I don't care what kind of a bee they have in their bonnet that day. I don't care if they don't like you. Okay. Rudeness, not acceptable. So that for me alone makes me want to tell this particular individual, leave that clinic. You don't need to deal with rudeness. You don't need to deal with sarcasm. You don't need to deal with somebody who has a complex. You don't. Okay. That goes beyond red flag. That's just basic human decency. Okay. But the fact that the other thing I don't like about what this person wrote me was that this particular prosthetist, they're trialing new product in the clinic and they're pushing her towards it. Now, guys, I'm all for prosthetists trying new technology. They need to, right? They need to try new technology. But if your patient is hesitant, if your patient is showing, signs that they're really not interested in trying the new thing, and that they actually want you just to continue with the previous model, that might not be the patient to try out the new thing on. Okay? You got to kind of read the room there. And again, I'm always encouraging my patients, hey, think about this. Think about this new piece of technology. But I'm not going to bully my patient or push them into trying something that they don't want to try. Even if I think it's what's best for them, they have to be the ones to make that ultimate decision. Okay? And then in this case where she didn't go ahead and try the new technology and it was a disaster and she's having a lot of pain. And now her prosthetist is kind of, I hate using this word because I think it's overused. The prosthetist is kind of gaslighting her right now. No. Okay, guys, enough. I'm here to tell you there are many fish in the sea. Okay, we're going to continue on that breakup analogy. There's a lot of fish in the sea. Okay, there's a lot of good men and women who are prosthetists who are amazing human beings, and they are darn good clinicians. You don't need to waste your time with this one. You don't need to waste your time with someone like that. No. First of all, the rudeness thing, no. Okay, and especially not if you've been with them and you've given them chance. No, it's time. It's time to move on. And I am here to tell you, at the risk of ruffling a lot of feathers, I am here to tell you it is okay to end that relationship and to move on and find yourself someone else. Okay. And those of you who have been amputees for a while now, if you're watching this show, then I know that you're a part of an amputee community of some sorts, because to find this show, you have to be in the support groups and things like that. Okay. So if you've been an amputee for over a year, chances are you've gotten to know other amputees, and you can start asking them, who are the good prosthetists in your area? Okay. Thankfully, you have a lot to choose from there. PTs, unfortunately, not so much. There's not too many of us that specialize in amputee care, but prosthetists, there's a lot of them. And there's a lot of good ones. There's a lot of good people out there. Okay. And guys, many of you have texted me about this, and I'll tell you, I don't have a special directory. I really feel like I should start putting an official directory together of clinicians, of PTs and prosthetists. But, I will do my best. If you send me, hey, Kosi, I live in this zip code, do you know of anybody? And I'm happy to try to at least point you in the right direction of somebody. Okay. But again, this is where you turn to your mates on the Facebook support pages and say, hey guys, who lives in this area and who has a success with a good prosthetist? All right. Chuck says, maybe if she's having trouble advocating for herself, get someone you trust to advocate for you. Absolutely. Absolutely, guys. Because, guys, I've been the patient, and I was so fortunate that my entire medical team was phenomenal. Okay. But in the case of my father passed away a couple of years ago, and I was the primary caregiver along with my mother. And man, did we have to advocate. I mean, we had to like put the boxing gloves on sometimes and really just go to bat for my dad, because my poor dad was declining because of his medical condition. And my mother is an incredibly intelligent woman, but just the stress of caring and being the caregiver, it was very frustrating. Okay. And we ran into some not good clinicians that were trying to walk all over my mom and dad. So yeah, I would go in there and I'd put my PT big girl pants on and go advocate for my dad. And guys, it doesn't have to be somebody who, it doesn't have to be somebody who's a clinician. I mean, yes, if you have a family or a trusted friend who's a clinician who can go to that appointment with you and help advocate for you, then go for it. Yes, absolutely. But in this particular situation, it just sounds like it's time to not even, it sounds time to just, you don't even have to announce to that clinic that you're leaving them. Just leave. Just go. Just go. Okay. And that's it. Bill says, I've come across amputees who don't think that they can change prosthetists. No, you can. You can change prosthetists. It is your right as a patient. It's part of your patient rights. I don't care what cruddy insurance you may have. Okay. Or if you don't have insurance. If you don't have insurance, then you definitely have choices. If you have insurance and you're being kind of hem-hawed in, then yeah, you might be restricted in some of your choices, but it's not just one prosthetist that you can go to. Okay. And yes, it might mean having to leave your zip code a little bit and travel a little bit, but no, please don't ever feel like you have to go to the prosthetist that your doctor is sending you to, or that you have to go to the prosthetist that came to see you in the hospital. Okay. Sometimes that works out wonderfully. Sometimes it doesn't. Okay. Same thing with physical therapists, guys. Same thing. Okay. Earl says, the more I hear, the more I'm blessed with everyone involved with my amputations. And yeah, guys, I mean, unfortunately, what we hear about on the show is the negative side. Why? Because the people who are happy with their clinicians, they're living their lives, right? It's the people who are not happy and who are struggling and frustrated. They're the ones who are going to send me the questions, right? But yes, I say this a lot, 9 out of 10 clinicians, they're good people. They're good people. They're good at what they do. They really want to help people and they want to help people get better, and they have a compassionate heart. Okay. Unfortunately, the 1 out of 10 sometimes stands out, and sometimes it's not easy to spot the bad apple right away. All right, let's see. Pat says 8 years out and still using a shrinker. Bill says, I find too that if I eat higher than normal sodium, my residual limbs swell. Shrinkers are great for that. Absolutely, guys. Absolutely. All right, guys. So that is it for this evening. We've got a lot going on the rest of April. I am going a little bit like, woohoo, trying to get everything done. This Wednesday, okay, big show. Okay. Integrum is coming, and they are bringing Ginny Thomas. I have been watching Ginny's Instagram for years now, and we have been trying to coordinate, and the stars and the moon and everything aligned properly. And we're going to finally have Ginny on the show on Wednesday. She has had osteointegration. She has had huge journey. Not only the loss of her limb, but the loss of a family member in the process. An amazing story, and she's an amazing young woman. And her prosthetist, Scott, who I had the chance to talk to a little bit, very cool individual. So guys, those of you out there who are wondering what a good prosthetist should look like, come to the show on Wednesday. We're going to show you an example of a really good prosthetist, and we're going to talk about alignment. So we're going to, talk a little bit of the mechanical techno talk of prosthetic devices. And again, this is something that we're going to kind of break it down for you so that you can understand what is alignment exactly, what does it mean when your prosthetist is trying to figure that out, and then how is it a little different for osseointegration. Guys, we do have some giveaways, and please, if you could please show your support, I would greatly appreciate it. On my Instagram and on my Facebook account, I have posted, a little reel announcing the show on Wednesday. If you guys could please comment on that reel and subscribe to the Integrum YouTube channel, that would just go a long ways to showing support for the show. So that's it. And Grant says, 7 years out and I found I sleep better wearing a shrinker. I know a lot of people tell me like the compression, especially if they have a lot of excess soft tissue at the end of their residual limb, that compression is just kind of nice to keep them secure. All right, guys, we saw a lot of people also on my Instagram channel, so shout out to everybody there. So I will see you guys tomorrow for, tomorrow. I just lost my screen there for a moment. Same bat time, same bat channel. God bless, guys.